Hello, I'm Dr. John Kruse, author of Recognizing Adult ADHD, What Donald Trump Can Teach Us About Attention Deficit Hyperactivity Disorder. And today I'm going to be talking about whether Mr. Trump has ADHD or narcissism or both. The format for today's talk is going to be similar to the previous Facebook Live, so I'll be talking for about 20 minutes. If you have questions while I'm talking, certainly feel free to type them in, and I'll try to address them at the end. And you can also wait till the end. I'll be around for a minute or two if there's to check for any questions, but if there's no questions, I'll sign out. If there's lots of questions, I'm happy to be here for another 20 minutes after the 20-minute presentation. And next week's topic is sort of a broader overview of ADHD along with other comorbidities. So what else might be going on with Mr. Trump? So I'll begin by saying that all the media seems to talk about is this Mr. Trump's narcissism or sociopathy. So they'll discuss scenarios of how his administration is disorganized and doesn't plan ahead, and he doesn't do his homework, and everything's in disarray, and he procrastinates, and he blurts things off at the top of his head, all of which are clearly ADHD symptoms, and then they'll say, and the guy's a terrible narcissist. So one question I'll only address peripherally is why is everyone else only talking about the narcissism and not the ADHD? So a couple factors. One is the narcissism or apparent narcissism leads to, I'd say, more bizarre societal breaking of societal norms. Whereas most of the ADD behaviors are things all of us do at least occasionally, and what makes them ADHD is that someone is doing them in a persistent, pervasive way. So being distracted for a minute isn't particularly unusual, but if you do it persistently, that's symbolic of ADHD. So I'll back off a little bit more for a bigger picture of why we even bother making diagnoses. And I've said before, 3 big reasons in psychiatry or the rest of medicine. We make diagnoses to understand what's going on, to predict what's going to happen, and in order to form specific treatment plans that have a likelihood of working. So if you don't pay attention to the ADHD and think he's only a narcissist, you're not going to understand a lot of what's going on. It won't make sense. You're not going to be able to predict accurately how he may respond in certain situations. And any treatment is going to be less than perfectly helpful if you're not treating what's really going on. So as I've outlined before, and I'm not going to go into detail now, we know definitively that Mr. Trump has ADHD. He has more than a dozen, and you only need 5 as an adult of the 18 symptoms listed, the inattentive, hyperactive, and impulsive symptoms. These are observable behaviors. They don't require anything other than observing a persistent pattern of behavior. Many of them have other researchers, and I've done a tiny bit myself, of actually documenting their pervasiveness compared to societal norms or norms of his peers. So he is definitely an outlier. And again, these are objective behaviors we can all look at. In contrast, I think it's highly likely that he does fit criteria for narcissism, but the criteria for narcissism are not objective behaviors. Although many of them are tied to behaviors, all of the parts of narcissism require our imputing, our conjecturing, our assuming that we know the motivation for the specific action. So for example, many people have said it's narcissistic. His whole mishandling of the COVID epidemic is showing how narcissistic and unempathetic, non-caring of others he is. And I'll say that may well be true, but we don't know for a fact. It could be that he's just oblivious to the needs of people, which would be an ADD issue in terms of not being really aware, not paying attention to. That is different than, yes, he's aware of, and he simply doesn't care. So I'm going to go through briefly the 9 criteria and the current definitions for narcissistic personality disorders. So, and as I'll go through each of them, you will recognize that they sound accurate. They sound like they resonate with Mr. Trump. There is actually a little bit of research showing how people do seem to be able to make fairly accurate assessments of narcissism and a few other personality disorders from watching videotapes of patients with these conditions. But again, while I think it's quite likely he has narcissism as well as his ADHD, we can only be certain about the ADHD, and I'd say the ADHD is a more pervasive problem. It underlines everything because ADHD affects how you process all information coming into your head and all commentary, behaviors, restraint in commenting or not, everything that comes into your brain, everything that goes out of your brain is affected by ADHD, whereas narcissism is affecting a subset of human interactions. So, of the 9 criteria for narcissism, number 1 is grandiosity. Number 2, having fantasies of unlimited success or unlimited brilliance. I mean, this is a guy who calls himself a stable genius. Number 3 is believes himself to be special. And you'll also note that a lot of these seem to be closely tied and overlapping each other. That's true. So again, you only need 5 of these 9 for narcissistic personality disorder. Number 4 requires excessive admiration. We've seen him literally begging crowds, begging his own cabinet meeting, having meetings just where people praise him, of withholding supplies to fight the COVID epidemic unless specific governors publicly praise him. I mean, that is not a false claim or fake news. There are multiple, and they're not only Democratic governors or local officials who have attested to the fact that they were required to publicly praise the president before he released supplies. A sense of entitlement, certainly that seems to be apparent. Again, it seems quite likely, whether we can be absolutely sure, it's harder to know. Exploits others. There's certainly lots of behaviors he engages in that seem to be exploitative of others. Lacks empathy. I think we're at 7. Number 8 is envious of others. There are examples pointed out last week where he was complaining publicly that Dr. Fauci was getting more attention and more positive attention than he was regarding handling the COVID epidemic. And number 9 is being arrogant or haughty. I'd say we've certainly all seen behavior where he acts as if he's above the law or even claims that he doesn't have to follow norms or laws or behaviors others have portrayed. So again, I think much of his behavior is consistent with narcissism. I think you have to understand both the narcissism and the ADHD together to understand what's going on. One other side note, many people throw around the term malignant narcissism as if it's a specific diagnosis with specific meaning. It is not something that's incorporated into the DSM-5 currently, our current diagnostic manual. So it's a term people can use largely to mean whatever they want it to mean, and particularly that he's bad and nasty about being narcissistic. But it, again, doesn't, I would argue, have a specific consensually defined definition for what it means. So why I say it's so important to understand the ADHD element is that people who focus on the narcissism are completely baffled, confused, and left their head scratching as to why this guy is continuing undermining his own successes. So why he blurts out comments that detract attention from him, that make him look less than intelligent, wonderful, all-powerful, all-knowing, all-wonderful. So an example along this regard, when he flew to North Korea 2 years ago for the second summit with Kim Jong-un, and he was clearly lobbying and thinking himself worthy of a Nobel Prize for if he succeeded in bringing peace to the Korean Peninsula and denuclearizing North Korea. He publicly said he wasn't going to study up about nuclear arms, he wasn't going to study up about North Korean culture, he wasn't going to learn anything specific to Kim Jong-un. And his aides were aghast because they knew that there was no agreement in place. There was nothing, the groundwork had barely been scratched for it. A person who is primarily narcissistic, unless they're extremely stupid, would have prepared and done more to make sure that this effort in the public view was going to obtain some amount of success. Again, he undermined his own likelihood of achieving success because of ADHD traits, not because he was so, the fact that he thought that he could just pull it off winging it. Yes, there's a narcissistic element, but again, there's clearly an impulsive, refusing to do homework, refusing to sit down and put in effort in things that require sustained thought that is so clearly of an ADHD element. So getting into why I think his ADHD, which we can be certain of, also makes it harder to ascertain whether he has narcissism. I've touched on some of this already. But one thing is that with ADHD to the severity that he has, he spouts out whatever he's thinking at the moment. And I've also talked a little bit about this is being candid, this is being true in the moment, but it is not necessarily a full distillation of what he's thinking or feeling on a topic. So again, he may be saying some comment that sounds dismissive, that might sound arrogant, that may sound like he lacks empathy, that may sound like he's exploiting others or believes himself special. But we really need to know for a narcissistic personality disorder that is his pervasive, ongoing internal state or belief. And again, if you are willing to say anything in the moment, and we all have seen him contradict himself minutes later, which statement is actually the true or accurate reflection of what's going on inside his brain? They're both capturing some element of what's going on at some time. But again, from the narcissistic personality disorder, you need to know, again, if he really dismisses the feelings of others and doesn't care about them, that is pervasive lack of caring going on, or that he's, so again, the very fact of him constantly giving us snippets of what's at the top of his mind makes it harder to know what the prevailing underlying truth of. I would agree with many people who say when so many of the snippets look so self-centered, self-aggrandizing, so grandiose, so inflated, so lacking of empathy, then it's a reasonable assumption. I'll give you that, but again, that's still an assumption. So number two, why ADHD makes it harder to diagnose narcissism is that many people with ADHD, and this is not just my observation, if you go to Driven to Distraction or other basic books on is it you, me, or adult ADHD, there's fairly extensive discussion that many people with ADHD come across as self-absorbed, and I would distinguish being self-directed versus being self-absorbed. So what I mean by that is people with ADHD talk about what's at the top of the mind or what's in front of their face, and usually parts of their own life are always in front of their face. So it's easy for them to be thinking, talking, focusing on what's in front of them, what they are feeling in the moment. And that can look like they don't care at all about people around them. It can look about that they don't care about input from others, but it doesn't mean that that's what they feel. And in my book, I use an example of the patient that got me interested in adult ADHD 25 plus years ago, and I'll call him Frank. So I saw Frank hourly for more than 20 years, hourly once a week. And almost a third of the time it felt, I haven't done the math, but it was more than once a month, he would take 20 minutes of a session saying that he had just gotten off the phone with his girlfriend, and they had been talking for 20 minutes, mostly him 20, 30 minutes, him doing the talking, and she would bring up at the end of the conversation, Frank, we've been talking, and all we've been talking about is you and what's going on in your life. And he'd sort of hit himself in the head and say, I can't believe how narcissistic I am, I can't believe it. And then in our session, he would talk for 20 minutes about how much he cared about her feelings, how much he felt that he knew he was coming across as a self-centered jerk, and he wanted to stop doing that behavior. And we did employ a few behavioral tricks that helped a little bit, but not completely. And I would tell him, Frank, if you are that upset about her feelings, if you're that concerned about the image you're creating, you're that concerned about not conveying your true feelings and asking about her, you are not a narcissist, because a narcissist isn't going to spend that much time being concerned that they're coming across as a narcissist in this setting. So again, there's aspects of ADHD that can make, in terms of how control of attention, direction of attention, letting go of attention is impaired, that can make someone look very self-directed, very self-centered. And again, that doesn't necessarily mean that they are narcissistic. So the third area where ADHD can look like or confuse the issue of narcissism, there is something called positive illusory bias, PIB. So that's positive because it's overwhelmingly positive. Illusory because it's inaccurate. It's not, it's just wrong. It's inaccurate. And bias meaning it's a persistent skewing of information. So about 30% of boys with ADHD in several studies have been observed to have what's called positive illusory bias. And that is where they overvalue their own accomplishments, their own abilities. So to clarify a little bit, all kids exaggerate a little bit. You know, my dad's 7 feet tall and can, earns $2 million a year, or boasting about their own care. I can run a mile in 3 minutes. Kids with positive illusory bias over-exaggerate their own abilities even more than average kids for their age. So two, this is not just a pervasive optimism. They don't think everything in the world's great and better than it really is. It's their own powers or own abilities that they're exaggerating. So does that sound a little bit like our Mr. Trump? I would argue that it does. Two, we know with normal optimism, if you give someone negative feedback, if they think, I'm the best math student in the class, and you just show them, well, Jimmy, you actually got half the answers wrong, and all the kids around you actually got 100% scores. Most kids will learn, even if they're overly optimistic to begin with, they will recalibrate their opinion of themselves based on new information. What's been observed with positive illusory bias, again, which up to a third of boys with ADHD have, is that they do not change their opinion when they are given negative feedback that would, you would think, dispel their opinion. And I'd say we see this in spades with Mr. Trump. He praises, look at how wonderfully he's gotten us testing for ADHD, testing for COVID, sorry. He's been bragging for months, and objectively, there has not been a single week in America where we have sufficient COVID testing to assess in time that's quick enough to be meaningful who has COVID at this moment, and how we can reach their contacts, impose sequestering, quarantining to reduce the spread of this illness. Yes, we do have more testing than any other country on the planet, but we also have many more cases than any other country on the planet, and we have a population that's bigger than all except a handful of countries on the planet. So absolute number of tests is meaningless in this regard. We objectively have not had tests where you can get answers back quickly enough to control any effective spread of this virus. We have failed, and that has been repeatedly pointed out to the president, and he still has not been able to incorporate that knowledge. So again, that looks like with positive illusory bias, maintaining your over-optimistic assessment of yourself in the face of contradictory evidence. And the third aspect that's been observed with positive illusory bias, usually if kids are more optimistic, if you think, I'm the fastest runner in the class, if you have that belief, and you see Joey gaining on you and Sally ahead of you there, you're going to work harder to achieve the goal that you think is really true in your mind. In contrast with boys with ADHD who have positive illusory bias, these overinflated ideas on themselves do not motivate themselves to work harder. They do not stay longer with tasks that are difficult for them. And again, we see this with Mr. Trump all the time. He thinks he's the best deal maker, and negotiations with the North Koreans have fallen apart. Negotiations with Congress over COVID relief packages, over formulating or revamping of the healthcare system and building an infrastructure. I mean, there's all sorts of things that this president hasn't put in the hard work to accomplish, even though he thinks he's a great deal maker, he thinks he's a great negotiator, he thinks he's a great builder of what's wonderful in America. So again, all of these factors, actions which we see in him may well be narcissism, or they may be positive illusory bias, which is an aspect of, again, up to a third of boys with ADHD. So in summary, I would say we have definitive evidence that he fits a full category, full diagnostic criteria for ADHD. It looks extremely likely. The speculation is that he probably does have narcissism. And I would argue that it's only when you understand both factors together that you can understand the level both of self-regard he has in combination with the incompetence in actually filling out the requirements of this job, or actually any other job he's had. So that's wrapping it up for today. Again, next week I will be talking more about ADHD and other possible comorbidities and how we can be sure, or we can be more, again, certain of the ADHD and less certain of other factors going on that could account for some of Mr. Trump's unusual behavior. I am not seeing any questions coming in. Again, if you want to hear some of this in more detail in my book, it's Recognizing Adult ADHD. It's available on Amazon and other bookstores online as audiobook, as Kindle, as Nook, and as hard copy books. And stay healthy and happy. I am signing out now.